Doctors and medical professionals, what one medical fact do you wish everybody knew? It's significantly more effective to prevent cancer than it is to treat it, but the world isn't interested because most people just want a pill to fix their problems. Don't smoke, wear sunscreen, don't drink excessively, get a bit of exercise, and eat some gosh dang vegetables. Do those, and bam! Huge drop in cancer risk, but nobody wants to hear it. Next story. Nurse here, if you're an alcoholic that's admitted to the hospital, don't lie about how much you drink. There are drugs we can give you to take the edge off of withdrawals. It's safer for you and safer for us. We're not judging you, we have safety in mind. Next story. Some new updates because no one learns. I work in a burn unit. Don't put accelerants on a camp or bonfire. Don't go back into a burning house or vehicle or airplane. Don't put accelerants on bonfires. This includes aerosol, cans of stuff, all of it, it all blows up. Don't make drugs unless you have an advanced degree in the field of chemistry. Don't put accelerants on bonfires, even if it just won't light. Don't let your pot handles hang over the edge of the stove where your kid can reach. Don't put accelerants on bonfires, even if you've been doing it for years. Don't pick up containers of flaming grease or oil. Don't put accelerants on bonfires. Diesel is an accelerant. Don't do it. Don't keep electric cigarettes in your pocket. If you wear oxygen, don't smoke with it on or in your lap. Don't burn trash. You don't know what the F is in there. Probably accelerants. Stop opening your radiator cap unless the car is cold. Carburetor injuries are common. I don't know how it happens, but help me out, car people. Also, don't put accelerants on your gosh dang fire. Next story. Smoking will kill you. Nah, cancer won't get to me, you might say. And you'd be statistically right. It'll be your heart. In the simplest of terms, smoking makes your arteries rigid. So as they progressively get filled with fat, instead of increasing their diameter, they'll just get stuffed until no more blood can get through and you'll be done for. If you're lucky, you'll get some chest pains beforehand, but that's not always the case. Joke's on you, sucker! I got a heart attack and survived. Death ain't got no crap on me. Well then, welcome to the world of chronic heart failure, where from now on, every day that goes by, your heart will be less a pump and more a container, until you get out of breath from just speaking and eventually die. There's no going back. Please stop smoking. Next story. If your kid has a fever and you give them Tylenol or ibuprofen to bring it down, they are still effing sick. You're only treating symptoms temporarily. You're not curing anything, okay? So for the love of everything holy, do not give them Tylenol and send them to the school or daycare or sports or birthday parties, etc. to become patient zero and infect everyone else. Next story. ER doc here. Medical fact. Emergency means potential loss of life, limb, or eyesight. It does not mean inconvenience, irritation, or chronic condition. Your sore throat evaluation in the ED is going to cost you $1,000. Please go to an urgent care. Next story. Reverse cowgirl may be a fun position for you, but please be careful, girls. Blood in your pee when not associated with pain and fever is something you need to get checked out. Also, get that new ugly mole checked, especially if it is painful or bleeds. Boys, if you notice some irregularity or growth in your balls, please get it checked early. If your ball is the size of a grapefruit, ignoring it will not make it go away. It will just increase the risk of the worse news than that you were fearing. It is much better to be labeled a worried well than the alternative. If we are stressed or rushed for time, it's not personal, it's the systems. We may not always say it, but we are grateful for those who take responsibility for their health. Next story. If you suspect a heart attack, take an aspirin or two. Not ibuprofen, not paracetamol, not some other dumb painkiller, an actual aspirin. Also, get yourself to a hospital, duh, but that aspirin might save your life. Yes, chewing is better, but if you swallow it whole, that will also work in a pinch. It's much easier to remember to take an aspirin, especially if you're panicking, than to also worry about how to take it. Aspirin falls apart quite easily in stomach acid, and it gets absorbed through the linings of your stomach either way. Always keep things as simple as you can and get the basics down first. In a pinch, you are much more likely to recall a random person on Reddit saying, "Heart attack equals aspirin," than you are to also remember, "And don't forget to chew." Next story. Not a doctor, but something a doctor told me when the incident occurred. Girls, if you get excruciating cramps at the time of your period and it feels much worse than it actually is, go to a doctor. When I was 13, I had already been confirmed of having an ovarian cyst, and it made it very painful for me during my periods to the point where I had passed out from the pain of it once. However, at one point it felt much worse than it typically did, and I blew it off as being because of my period. It turned out my appendix was bursting. The doctor told me a lot of women blow off period cramps because doctors tend to do the same. Don't. It almost meant life or death for me. Next story. Just don't lie to us. We don't judge you because your poop is smelly or you like to put things up there. Just remember, always, we've seen something far, far worse than the gerbil up your butt. Oh, and don't effing drink and drive. Next story. Vet tech, your cat is probably obese. So many people free choice their cats because it's easier or just way overfeed their cats because they whine a lot. You're not doing your cat any favors. He's going to get diabetes. I'd guess that about 10% of cats I've seen are actually at a healthy weight. Get a good wand toy and play with your cat every day, and for God's sake, limit how much they eat. Also, treats are supposed to be less than 10% of your pet's caloric intake, so cool it with the treats. Next story. Know the signs of a heart attack and stroke and don't try and tough it out. These are time-sensitive and potentially deadly events. Paramedic here. Super frustrating when I get a patient who didn't call early enough and because of that they can't get life-saving treatment or the damage is already done. Next story. RPH here. Do not keep your medicine in your medicine cabinet in your bathroom. The steam from a shower and the temperature fluctuations will degrade your medication. Keep them in a cool, dry place away from direct sunlight. Also, look through your OTC items in your house and clean out the expired drugs and restock your basics. Ibuprofen, acetaminophen, Pepto, eye drops, etc. Next story. Nurse and midwife here. I wish people understood that if they are receiving treatment for a condition, they still have that condition. Case in point, if you are taking medication for something, you aren't suddenly free of that disease. Your blood pressure meds are maintaining a normal blood pressure because you have the condition of high blood pressure. Your insulin is maintaining your blood sugars because you have diabetes. Sounds simple, but amazing how much people tell us they have no conditions, but are on 1,000 medications that tell a different story. Next story. Your immune system is one of the greatest assets you have, and you never thank it. In your life, your body will autonomously eradicate between 6 to 10 different cancers without your realizing. It will fight your infections, repair micro-traumas, and police the entire population of billions of cells in your body without your asking. All it requests in return is a little bit of health to preserve it. So stop smoking, lose a little bit of weight, maybe exercise a little, and don't drink so much. Your diet is so much more important than you realize. Next story. Vaccines are the greatest advancement in modern medicine. They save lives and prevent weeks of lost work each year. Flu season. If people started seeing more whooping cough or epiglottis, part of the throat swells up and can kill children, they'd get their shots. But vaccines have become victims of their own success. Get your shots to protect immunodeficient people that can't get their shots. Next story. Doctor here, don't stop your medications by yourself. Just don't, no matter how good you feel. Patients stop antibiotics and relapse. So many resistant TB cases here. Stop taking insulin and come with DKA. Don't stop any drug unless cleared prior with your doctor. Most of the diseases can only be managed. They can't really be cured. If you have diabetes, get sugar levels tested at least once a month. Don't ignore it. Don't mix alcohol and antidepressants. Also, no matter how bad it is, we have seen worse. Please don't be ashamed. Pulling out doesn't mean she won't get pregnant, by the way. And last, if you see anyone vomiting and a loss of consciousness, turn them to their side. Less chance of it entering their lungs. Next story. Alcohol withdrawal is deadly. Many of my patients don't know this, but it's a gamble. I've seen fifth of vodka day drinkers with no withdrawal, and 2 to 3 beers a day withdrawal. It onsets quickly, and it's deadly. Anyone who drinks almost daily and is trying to just quit cold turkey needs to understand this. And please notify the family at the bare minimum. Next story. Volunteer SAR ship crew member here. When you suspect whoever is lying down is not breathing by themselves, begin CPR immediately and do not stop until medical professionals arrive, even if this means that you have to go on for several hours. We do not perform CPR to have the patient miraculously wake up and make out with us. We do this to sustain the most vital bodily function, the circulation of oxygen to the brain, until we can get that person to a hospital. Next story. I may be alone in this, but I want my patients to know that there is no possible way I can keep up with all the medical advances and new studies that are out there. Also, I want them to know that there are thousands of conditions that I learned about in medical school that I've forgotten because I've never seen or recognized them in practice. This is important because my patients frequently apologize for looking up things on the internet. No, don't apologize. I want you to research your condition. I want you to look things up. I want you to know about new treatments, new research, and alternative medications, because often I don't. I may not agree with the things you've read, and that's okay too. Ask me about the things that you've read and the picture you found that looks like your rash. I can't tell you how many times a patient has come to me with a suggestion about a possible explanation for symptoms because they read about it on the internet and it turned out to be correct or at least a reasonable guess. Please, feel free to educate yourselves about yourselves. Some good websites are the CDC website and the AAFP.org. The American Academy of Family Practice. And if your doctor is offended that you are trying to be educated, get a different doctor. Source, I'm a doctor. Next story. Clinical psychologist here. If you need mental health treatment, try your local college campuses. Oftentimes there are training clinics supervised by some of the best clinicians around. Most will provide a generous sliding fee scale. Treatment works especially for sleep problems, depression, anxiety, PTSD, etc. Also, do not ignore mental health problems in your children or adolescents, including when you are concerned about substance abuse. Early intervention works best, and if you wait until they are 18, they may not get treatment for another decade because they refuse to go in until they mature into their late 20s. So if your child or adolescent is showing signs of a mood or anxiety disorder, self-harm, struggling with ADHD, using drugs regularly, weekly or more, and you are concerned, consider an intake assessment with a licensed psychologist. Next story. Former EMS here. Don't get angry when that quiet person gets taken out of the ER waiting room before you. You have a headache and are raging and I can't help you. But that person who just got taken back is quiet for a reason. You're not dying. Death is quiet. I can't tell you how many times I took someone to the ER yelling and kicking and screaming, and when we roll up and they get looked at, it's often minor. I've seen people who I had a feeling would not make it. They don't rave like idiots. They lay still and quiet, and it's almost eerie. Next story. Not a doctor, but 1 year off of the mark. As a training psychologist on an interdisciplinary team, I wish patients knew that community resources often work on income-based sliding fee scales to meet the client financially. Let's be real. Mental health coverage is trash right now, but there is an abundance of professionals who acknowledge this and advocate in-house. It is definitely worth asking around. Next story. If you get in an accident as a biker, don't take your helmet off your head under any circumstances. You can unhook the strap if you really need to not suffocate, but that is it. Stop reading here if you are faint of heart. Many times, your head will break like an egg, and the helmet is basically the only thing preventing your skull from being skewered by your cranium shards or spilling all out. Next story. ER nurse here. Got a few of these, but this is my biggest pet peeve. You can't cure your diabetes by ignoring it. And stop eating 5 extra pieces of cake and just injecting more insulin. That's not how this works. Also, it doesn't matter if you only drink Diet Pop. Diet Pop is still terrible for you, especially if you're diabetic. Just drink some effing water, guys. Next story. If there was the slightest bit of benefit from that alternative health treatment, mainstream health would be all over it. No one passes up a profit or the chance to empty out this mega overcrowded hospital for some kind of philosophical hang-up. Which overcrowded hospital? Every single one in the world, bar the private US ones that permanently have beds. Everyone else is struggling. So 99% of hospitals. Next story. If you want to keep your hands and fingers and upper limbs intact, do not punch a wall, a car door, a guy in the face, bricks, anything. you will end up with a boxer's fracture or a break of your fifth metacarpal bone. Most of the time, everyone will know you were drunk when it happened and it's not comfortable or fun. Do not reach into the chute of a running snowblower even if it stopped because something is stuck in there. Do not attempt to fix your chain-driven garage door opener by putting your fingers in the track and asking your wife to hit the button. Do not reach into an auger at work trying to retrieve your safety glove that just fell in there. Do not hold on to something at work that winches rope. If you have a wound on your hand or fingers and arm and it is oozing something that looks green, yellow, white, or pink, anything like the rainbow, please go to a doctor, have it looked at. You may save yourself from an amputation. Source: I'm an RN at an orthopedic surgery center. All of these things have happened numerous times, and yes, archaic as it seems, sometimes people have to get fingers or even hands amputated. In this day and age, I know, because they ignored something as simple as an infection. Next story. Physical therapist here. Take time to build up your strength and endurance. You didn't get weak overnight and you won't get strong overnight either. Also, with the exception of pregnant women, bed rest doesn't make you stronger or healthier. Quite the opposite. Every day you lay in bed and rest, you have to work for 3 days to recover from the muscle wasting. Next story. Australian paramedic intern here. We are not the police, and we really honestly don't care about any of the crap, illegal or not, you have done or taken. We just need the full story to make sure that you can get the best targeted treatment. Also, we don't mind getting called to old people falling and not being able to get up, especially if they have no family or no way to contact them. For me, that's a medical emergency, because if you stay there, you will die, and paramedic school taught me that that is bad for you. Next story. The mnemonic device for signs of a stroke is FAST, F-A-S-T. Face observed drooping of one side of the patient's face. Arms ask the patient to raise both arms to shoulder height. One side will be unable to comply or will be unable to maintain at height. Speech. Patient is slurring their speech. And time. Determine the last time the patient was behaving normally. If this time is very short, there are medications first responders can administer. If it's been several hours, frequently overnight, the risks of such medication outweigh the benefits. Next story. Priority is given to patients according to their level of state at the time. Be a patient. It's not a simple first come, first served basis. In the meantime, go over what you're going to say. Write out your own little medical history and synopsis of your current predicament. Use your time wisely whilst you're waiting to be seen. This will help clarify things and save consultation time, meaning everyone gets to be seen more quickly. Next story. I am late to the game and this will get buried, but take your gosh dang blood pressure medicine. Please, I'm so tired of seeing young adults come in with kidney failure because they didn't want to take their meds. Most of it's cheap as dirt. You can get $4 generics at Walmart. Next story. If you're prescribed a pill for a chronic condition, you'll probably be on that pill for the rest of your life. And that's not a bad thing. It's keeping you healthy. I've seen too many people stop taking their blood pressure or seizure medications because I was feeling better, so I thought I didn't need them anymore. No, you were feeling better because you were taking them. Don't stop taking any long-term medication without consulting your doctor first. Next story. Oh yes, we will always be there and will always, by law, take all comers. However, just as you don't go to a cardiologist for foot pain, don't seek care from an emergency medicine physician for your non-emergency. We are highly trained in true emergency situations. It's what we love. However, once it has been assessed you don't have an emergency, you get our best educated diagnosis, which may fall short of the true diagnosis and treatment regimen because we don't have the tools or time to fully work up every complaint. Next story. Please go get your yearly checkup bloods done. 2 tubes of blood will tell you so much about your health. It is way easier to treat conditions early than later. My grandma let her chronic leukemia get way out of hand before going to her doctor about it. If she had a yearly checkup, she'd probably have found it much earlier on and not have had quite the intensive bout of chemo she had to have. She's fine now, but I'm still annoyed she never went to her doctor earlier until she was really, really sick. Next story. One that I hear from nurses I know is apparently some people don't know that antibiotics won't work on viruses like the common cold. If you take antibiotics for the cold or the flu, it won't help you, and it'll just spread resistance to more bacteria. Only take antibiotics if the doctor recommends it before you bring it up. I'm often shocked to discover that people don't know this one. Next story. Losing weight when you didn't really try to lose weight is cancer until proven otherwise. People ignore this sign so often, and when we finally make a diagnosis, it turns out they noticed the weight loss months ago and could have been picked up earlier. If you lose more than 5% of your body weight and didn't try, see a doctor, even if you are young. Make an advanced healthcare directive. I work in the ICU. We can essentially keep you alive on life support indefinitely as a vegetable, but nobody wants that to happen to them, so make sure it doesn't happen to you. At some point in your life, you'll probably have a colonoscopy. Most people have one. Nobody admits they had it, but don't be embarrassed by it. Also, don't smoke. Eat crap, drink alcohol, skip exercise, never go outside, binge TV, but just also don't smoke. Okay, you can eat crap, drink alcohol, skip exercise, never go outside, binge all the TV you want, but just do not smoke. People always talk about lung cancer as the reason not to, but YouTube COPD. The ones who don't die of lung cancer die a slow and drawn-out death, where they essentially get more and more breathless over about 10 years. It's horrible, and unlike lung cancer, it's near guaranteed to happen to lifelong smokers. If I was a smoker, I'd rather get lung cancer and die quickly than face COPD. Next story. The hospital is not a Hilton. I'm sorry I have to wake you up in the middle of the night to assess you. I'm sorry I can't be at your beck and call every second of my shift, and I'm sorry I have to follow orders and safety regulations. But you are sick, and we are here to help you heal, not give you a spa vacation. Everything we do is for your benefit, even if it isn't the most fun. Next story. Former combat medic with the Army. Don't wait to get treatment. Rarely will it just go away or get better. I can't count how many times I'd do primary evaluation of a patient who came into sick call in the morning with some sort of ailment, or when I'd ask how long they experienced the symptoms, I'd get a response like, I don't know, maybe a month? A month? That's no longer an illness, guys. That is a condition. Remember, the older you are, the less likely you are to bounce back from an injury or illness. And not getting it taken care of right away can end up making it a lot more difficult to treat and recover from. And practically speaking, getting something cared for immediately means that you're going to suffer for a lot less time. Next story. Not a doctor, health economist. People need to know what opportunity cost is. If you have a treatment, someone else can't. Every healthcare system is overburdened in some way, and all resources are finite. If your doctor says you need to exercise, eat healthy, and take statins, do it. Having a stroke or myocardial infarction doesn't just suck for you, it also sucks for the person who needed the ambulance too, but hadn't been given the necessary drugs and lifestyle advice to prevent an assault or a car accident. If you can take steps to prevent something, do it, because it's not just your own life you're saving. Next story. That if you abuse your body, one day it's gonna tap out on you. You don't have to be a marathon runner or a bodybuilder, but just take care of yourself. Women, stop talking about fat shaming and lose some gosh dang weight. You may be big and beautiful, but you're slowly dying. You have type 2 diabetes, heart disease. You're an effing time bomb. Men, you're just effing yourself over. Believe it or not, living an unhealthy health style is unhealthy. It's putting a burden on our already overburdened healthcare system. Oh yeah, stop demanding an antibiotic for every sniffle. You're killing the human race. You're just breeding antibiotic-resistant superbugs. Pretty soon, nothing will help with infections. Let the plague begin. Next story. 1. HPV is extremely common. Basically, everyone who is sexually active and over the age of 30 that wasn't vaccinated has or has had HPV, and most young and healthy people will clear the virus on their own. 2. If something isn't right and your provider is dismissive, go to someone else. You have to advocate for what you need. 3. Cigarettes are the worst thing you can do for your heart. Smoking will build plagues that can block blood flow to your heart and cause a heart attack. Next story. Don't ask for, or take if in your country it's sold over the counter, antibiotics when you have a common cold. Not only does it not help, you are also contributing to the spread of multi-resistant bacteria. Background. First, a common cold is defined by a runny nose, clear, not putrid, fever, general feeling of being unwell, sore throat, coughing, etc. You don't have to have all of these symptoms, but all can occur. It is usually self-limiting and a viral infection. Antibiotics work against bacteria, so there's nothing to win here. The indiscriminate killing of potentially beneficial bacteria by antibiotics helps selecting the strongest, which may be those with resistance mechanisms that can bite you or someone else in the butt later. If you are not at a risk population, like under 65, not immunocompromised, no chronic heart or pulmonal conditions, you'll get over it. Just taking it slow for a few days, staying hydrated. The latter is the most important. But only if breathing becomes painful or symptoms get worse after a few days, antibiotics may be called for. But so would be blood work or maybe an x-ray, so you should see a doctor before starting to take these. Next story. Former GI professional here. 9 times out of 10, your horrible stomach pain can be solved by just taking a dump. Sounds simple, but it can really be that easy. Chronic liquidy stools? 9 out of 10, it's your diet. Chronic constipation? 9 out of 10, it's because you aren't drinking enough water. If you're a male at 50 or a woman around 40 to 45, go schedule a colonoscopy. Seriously, do it. A small polyp that we can take off in 10 seconds will become a larger problem if ignored. So many people that came in at the right age and saved themselves a lot of bull crap later in life, or literally saved themselves from colon cancer because we caught it early. At the same time, so many that put it off for years and came in with a very, very serious colon problem. Go do it. It sucks, yes, but so does cancer. Next story. Good health has very little to do with doctors. 90% of health, or not, is related to lifestyle. The other 10%? Luck. Doctors are great at dealing with the fallout and picking up the pieces, but better to try to avoid needing us in the first place. Doctors and patients tend to grossly overestimate the benefits of medication and underestimate the importance of lifestyle. Boring but simple, okay? Exercise, eat well, don't smoke, don't drink alcohol in excess. If everyone did this, we'd need far fewer doctors. There are factors that affect people's ability to make healthy choices: advertising, taxes, income distribution, green spaces, childhood development, etc. That's why it is important to advocate to policymakers across government departments to work together to tackle public health problems. Solutions are not found in silos, nor are they found in your doctor's office. The evidence for non-policy-based interventions having any meaningful impact on a population basis is very scant indeed. Next story. Calling an ambulance will not get you seen faster in the ER. I will put you in the waiting room so you can wait behind everyone else. Everyone is triaged and treated in order of severity. Also, try helping yourself by taking ibuprofen for your headache or withdrawal for your nausea. Going to the hospital to ask for these is a waste of everyone's time and their energy. Next story. The vast majority of ear infections don't need antibiotics and will resolve on their own in a couple of days. The most common rare complication is rupture of the eardrum, which rapidly heals and doesn't seem to happen less when antibiotics are given. The antibiotics commonly prescribed are probably causing more side effect harm than actually helping. Give them some ibuprofen and see your doctor if the kid is still having pain after a few days. Next story. Morbid obesity is pretty bad for you. I mean, sure, everyone knows it's not healthy, but I feel the average person doesn't realize how bad it's effed you up in almost every way possible. I'm talking heart disease, stroke, back pain, joint damage, diabetes, colon cancer, all of it. Not only that, but you literally cannot properly get quite a few diagnostic tests in the hospital when you're too fat for the equipment. MRI or the needles, LP. All the major radiology modalities such as MRI, CT, and US are much less effective on the morbidly obese for various reasons. Next story. Nurse here, a little late, but I hope a few people see this. Even if you are in your teens or 20s, everyone should perform monthly self-breast exams and testicular exams. Both can be deadly very quickly. If you do notice a lump or something irregular, please don't ignore it. It's not going to go away. Go see a doctor ASAP. Your doctor or provider should have taught you how at some point, but ask them to show you the next time you go in. It's nothing to be ashamed of, and I can't tell you how many patients I've seen die of those 2 cancers simply because they ignored it. We're all just too embarrassed to come in about it, but, better to notice it before it's too late. Next story. Smoking, diabetes, and sitting on your butt don't immediately kill you. It's the fact that they slowly, tortuously kill you over the last 2 to 5 years of your life that you should know. It's so much fun having a nurse gag you relentlessly for 60 seconds, 3 times a day to clean your trach. It's so much fun going without legs for the last few years. And it's so much fun living in the hospital most of the time because it's better than going into a nursing home. Yeah, that's what I wish people knew.